following video shows an arthroscopic repair for shoulder dislocation. The most common finding following a shoulder dislocation is a tearing of the labrum off the socket of the shoulder or glenoid. This labral tissue needs to be reconnected to the bone to restore shoulder stability. The correct positioning for cannulas are then established utilizing a small spinal needle to allow adequate access to the tear to allow appropriate instrumentation for the repair. A cannula is then placed into the shoulder. These cannulas are placed both in the front of the shoulder and in the back of the shoulder. The labral tear can now be well visualized. A small elevator is used to elevate the tissue off the shoulder socket so that it may be repaired in the appropriate position. This mobilization allows for the tissue to become in a more anatomic position following the repair. A small drill guide is then placed through the cannula along the bone of the shoulder. A drill is used to place the first anchor to repair the tissue. These anchors are absorbable and have sutures attached to them that allow for the repair. Sutures are then grasped through the posterior cannula. Through the cannula in the front of the shoulder, a special arthroscopic suture passing device is used. This device allows for the tissue in the front of the shoulder to be appropriately tensioned so that the shoulder will no longer be unstable. It is used to pass suture around the shoulder capsule and labrum for the repair. A small passing wire is passed from this instrument out the cannula in the back of the shoulder to allow the suture to be passed around the labrum for the repair. Arthroscopic knots are then tied to secure the tissue. A second anchor is then placed, again utilizing the drill and guide. Suture is again passed out the cannula in the back of the shoulder, and the specialized instrument is again used to advance the tissue to further tighten the front of the shoulder. The passing wire is used so that the limb of suture can be passed back around the labrum for the repair. Arthroscopic knots are again tied, and one can see how the tissue is tightened in the front of the shoulder, as evidenced by the large roll that is formed. A third and final anchor is then placed to complete the repair. Sutures are again passed around the labrum and tied. A completed repair is then visualized. Thank you.